Uganda's population growth rate of 3.02% is one of the highest in the world. Women legislators now want government to ensure that all women who need contraception have easy access to it in order to control unwanted pregnancies. Women parliamentarians claim that in some places, women move long distances in search for family planning commodities, an issue that needs to be addressed urgently.
We have even health center tools, but now when you look at an area like in Chitukutwe, that's in Wakiso Chira, but the health center is that side of Chimwany, whatever it is, that distance is really so long, over 5 kilometers, much as it's urban.
We have inadequate family planning services, and these women are so much affected. That is so alarming in our district. So we are trying to see how to support these women by seeing the maternity units, how they are able to support them. But like I said, some sub-counties do not even have health centers. Yet the policy of health now is that every sub-county should have a health center.
The call for the need to scale up family planning services comes at a time when Ministry of Health is trying to push the family planning agenda 2030 to ensure the provision of information and family planning commodities. This also includes provision of reproductive health services and information to women and girls.
Health-seeking behavior of adolescents, they normally want more adolescent-friendly services. So we need to be able to get into systems where we have either IT services, so that people can be able, you might not necessarily need to visit the facility, but if you need information, you can be able to access it just through your phone or any other platform. So many of them have been developed, and we think that they should be able to spread all across the country.
Retaining girls in school is also a measure indirectly helping to control population growth.
There are facts and there are reports that are attached to the longer period one stays in school, the longer one will take to produce. We are having those findings.
However, as government struggles to push the family planning agenda forward, there's still unresolved issue of sexual education, especially for school-going youth.
Teenage pregnancy and unwanted pregnancy, most times the early marriages and all that. It goes back now to how much information is actually provided. This brings in the integration of sexual and reproductive health and rights, the issues of we sometimes talk of sexuality education and then people are thinking of we are talking about sex, which is not the case. You provide education, you tell people what they must expect, the issues of adolescence, the changes they are going through, those sexual feelings, what does that imply, how do you actually work around the self-control, issues of abstinence. All of them are actually part of sexuality education.
Government is trying to increase access to family planning because it is looked at as a key development issue now that the country is aspiring to achieve the middle income status by 2040.